This is a quick overview of liver disease and how to approach it. I've broken it up into two major presentations. One of them is just the asymptomatic liver function test abnormalities. Liver function test is a little bit of a misnomer, considering that some of these don't really show whether or not the liver is working, like AST and ALT are enzymes that are found in the liver, but they are not necessarily a measure of the liver's function. Some of these others, like albumin and prothrombin time, are better measures of how well the liver is functioning, because the job of the liver is to produce proteins such as albumin and platelets, and also to detoxify the body. So AST and ALT are the ones that you see most commonly. AST is generally elevated more in alcoholic disease, and ALT is generally elevated more in viral hepatitis. So we'll talk a little bit more about the different etiologies here. The other way that liver disease is going to show up is with symptoms, and these are probably the liver disease patients that are farther along and more serious. There's two main causes for symptoms in liver disease. One is the backup of blood going to the liver. If the liver is not working properly, especially in cirrhosis, either alcoholic or viral cirrhosis, post-hepatitis cirrhosis, you get a backup of blood. This can also happen if you have some kind of blockage in the portal cable system, like in Budd-Chiari syndrome. So if the blood is backing up, then you get ascites from the extra backup of pressure. Ascites is also related to the decreased liver function that we'll talk about here in a second. And with ascites comes an increased risk for spontaneous bacterial peritonitis. So that's something to keep on your radar if you have some kind of acute abdomen situation. Splenomegaly is associated with this backup of blood. It makes backs blood up into the spleen and makes the spleen enlarge. Caput medusae and varices are just a function of an increased amount of pressure in the venous system, just as jugular venous distension is. The places that you'll find these varices include esophageal varices. That's the big one where you need to be worried about esophageal variceal rupture, where you get hematemesis, and a lot of these people die this way. Hepatorenal syndrome is a function of decreased blood supply to the kidneys, which can end up giving you kidney failure. So the other set of symptoms are related to the fact that the liver is not producing proteins like it should, and also that it's not clearing toxins like it should. So edema comes from the decreased oncotic pressure that's associated with a lack of albumin. Gynecomastia and spider angiomas, as well as hypogonadism, are all related to the fact that when you have a decreased amount of albumin, you have a functional decrease in the amount of male hormone, or an increase in estrogen. And so you get gynecomastia, you get spider angiomas, and you get hypogonadism. You also can see temporal proximal muscle wasting. I actually don't understand the mechanism of that. Pruritus and jaundice are because of the buildup of bilirubin. and hepatic encephalopathy and asterixis are also a buildup of toxins that aren't being cleared by the liver, and bruising, spelled Bruising, and bleeding are because you don't have enough platelets. So when you have either increased LFTs or these signs and symptoms, then you want to take a good history, asking about drug or chemical exposure. There's a lot of drugs that can lead to liver damage. I should have included some of those here, but we'll get them on a different video. Sexual activity history is important because hepatitis B is almost exclusively transferred sexually. Hepatitis C can be in around 10%. IV transfusion history is usually associated with hepatitis C. Anorexia and weight loss are good questions to ask. Ask about abdominal pain, fever, pruritus, GI, stool, urine changes, and CNS complaints. All of those can help lead to an understanding of whether or not people are symptomatic for their liver problems. So when trying to figure out what's going on, this Vindicate mnemonic that is used almost universally as a differential diagnosis guide works really great here because almost all of these apply. Vascular problems, we talked about Budd-Chiari syndrome can cause damage to the liver, infection like hepatitis, inflammatory, and autoimmune. There is an autoimmune hepatitis. There's also primary sclerosing cholangitis, which is most likely an autoimmune, and primary biliary cirrhosis is also probably autoimmune. So all these are inflammatory / autoimmune diseases that can cause liver damage. Neoplasms, hepatorenal carcinoma is an important thing on this differential. And drugs, like I mentioned, we'll go through the drugs that cause liver damage later on. Iatrogenic, I can't really think of an example there. Congenital, developmental, or inherited. You can have a primary biliary atresia in neonates, as well as anatomic problems. Trauma could cause a liver problem, as well as environmental exposure, endocrine, metabolic. So hepatitis, non-alcoholic steatohepatitis, often called NASH, just fatty liver. Usually that's going to be associated with obesity. Cirrhosis, often of alcoholic origin. Hemochromatosis, which of course is a buildup of iron. Cancer, Wilson's disease, a buildup of copper. Primary sclerosing cholangitis, which we mentioned under the autoimmune, as well as primary biliary cirrhosis. Budd-Chiari, which we mentioned. Gilbert syndrome is a problem with bilirubin metabolism, which usually is asymptomatic. And Pompei's disease we usually associate with heart problems, but is also a problem with the liver as well. So some of these we can treat by, removing the underlying problem. For example, with Budd-Chiari syndrome, sometimes you can do surgery to provide extra blood supply to the liver. You can manage some of these symptoms, but ultimately liver transplant is the only way to really correct the problem. Sulfasalazine is in experimental trials with the possibility of reversing liver damage or aiding in the reversal of liver damage. So we'll probably see some of that in the future. So thanks to those who provided the images, and please leave us your comments so we can improve these videos. Help us to know if there's information that we should have put in that we didn't, or if there's incorrect information. And again, thanks